Gary mentioned earlier that the theme for this year is that health centers are home of America's healthcare heroes. How many heroes we got in the room today? People who work at health centers, raise your hand. People who work here. People on the board members, former staff. All of you are heroes. It is said, and I'm sure Congressman Melanson will agree with me, that there really is no higher calling than to be of service to your fellow human beings. And one of the highest forms of service, and you see it here in this health center every single day, is to care for those who are sick, to help them get better, to help them improve their health and then maintain their health, and to live a good and well and healthy and satisfying life. That's really what health centers are about. When they were founded back in the 1960s, poverty was endemic in the country. It was deep and wide. It was here and it was all over the country. It still is today. And yet, today we have 18 million people in America who can claim, regardless of whether they have the ability to pay, regardless of the fact that many don't have health insurance, or the health insurance won't cover the care that they need. It doesn't matter. You can go to a community health center, you can get the care you need, regardless of what your status or situation is. You will be cared for, and most importantly, that care will be rendered with decency, with dignity, and with excellence. The other thing that I'm most proud of, and by now you can tell that I may have walked the walk, but now I talk the talk. I do an awful lot of that, and I'm proud to do it. And what gets my head up off the pillow every morning is knowing what you're doing with the resources that Congressman Melanson and his colleagues, with his leadership, okay, bring into communities like this through programs like the Community Health Centers program, like the National Health Service Corps scholarship program that brought Dr. Wiltz here to Franklin for a 3-year stint, right? How many years ago?
26.
26 years ago, and he's still here. He's still here. We had a press conference on Monday, and Gary was wonderful enough to participate in it. We just released a study that talked about the shortage of primary health care providers, physicians, nurse practitioners, nurse midwives, mental health professionals, oral health, dentists and hygienists, nurses, outreach workers, social workers, all the people who make a healthcare system like this work, and how many more we need, because we are not even scratching the surface. With 18 million people that health centers serve across the country today, there are, by our count, 56 million Americans today who don't have a place that they can call home for their health care. They don't have a family doctor. They don't have a regular source of care. When they get sick, where do they end up going? Emergency rooms. Or, worse yet, they don't go get care. They put it off. They wait until the sickness gets worse. And not only is it more expensive for them and for all of us, especially if they can't afford it, it's worse for them as well. It impedes their ability to get well and stay well. That's what health centers are about. Turning around whole communities to make a difference in their lives. I remember, I was talking about that, and this is what I want to close with, is congratulating you for the great, great progress that you've made. It was 30 years ago this summer that I came to Franklin, Louisiana for the first time. I had just finished up my job at a health center in Texas, and I had gone to Washington. I was rather young then, but I was working for Secretary Califano at the Department of Health, Education, and Welfare, as they used to call it then, during the Carter administration. And I had promised Rose Mae Broussard and Alice Drepchinsky, when they had come to visit my health center in South Texas, that I would come visit them. I hadn't been able to do that from Texas, but I did manage to come from Washington. And I tell Gary, and I know Alice will remember, I managed to hit the bridge at Homa right at the point that it was opening. And sat for an hour and a half waiting for the ships to go through and the bridge to come back down. But it didn't matter, because it was such a revelatory, such a wonderful visit for me. I remember the little old house with the beautiful front porch. I looked at it and I said, I'd love to retire there and just sit out on the front porch and just talk with the local folk all day long about their lives, about what's going on. And now I come here 30 years later, I see this facility, the buildings next door, the work you're gonna be doing here, the additional satellites that you've developed. Most important of all, the wonderful care that each and every one of you who works here with the health center or is on the board ensures is provided to thousands of your fellow citizens right here in this community and all throughout this Bayou country. This is, as I said, the highest calling, to be of service to each other and to the people of your community. Last of all, I want to say a word about board members. I know we have at least one board member, maybe a couple of others.
Yeah, you can raise the hands. I was going to introduce
My greatest heroes are the community board members who sit on the boards. Alice, you're on the board too, right? And do it because they do it not for a salary. We get a salary for the work that we do, but they do it strictly for the love of the community because they care so much about their fellow neighbors and people who live in this community that they will give of their time and energies to direct the work and the progress and the direction of their health center. You know, every health center in America has a board, a majority of whose members by law must be actually registered patients of the health center. They get their care here. One of my staff calls us patient democracies. I call it healthcare of the people, by the people, for the people, in the finest tradition of American democracy. It's what I wish the rest of our healthcare system could look like what we see right here in this room today, and like what you see every day when the patients come in to receive care. This is what we should all strive to be. This is excellence, okay, at its very best. And I thank you for the wonderful work you do. I thank you, Gary, and the board for the invitation to spend a few minutes with you today. I thank you, Congressman Melanson, for your great leadership in Washington. If it wasn't for you leading your colleagues forward, we wouldn't have places like this, not just here in Franklin, but all over the country, to be able to serve people in need and do it, as I said, with dignity and with excellence. Keep up your great work. We've got much work to do. Those 56 million people are still waiting outside the doors of our health center today. We need to find the resources to reach out and serve every single one of them, because our goal is to strive for good health and affordable health care for every person. Thank you so much.